Are we still waiting for?
It appears we are waiting for a couple more folks to join us, but if you'd like to get started, we certainly can go ahead. I think we're expecting the child support director. We've got DOC coming on board. I think we're expecting uh, Manager Radcliffe and Public Health was invited, but they weren't able to join us today. But hopefully they'll be more involved as we move forward.
Lori is going to be late. We've been slammed, so she's dealing with some crisis stuff.
Okay, well, I'd say let's just get started at 3:30. I'll call the Drug Endangered Children Work Group meeting to order. I don't know if we quick want to go through, I think everyone knows everyone other than Jamie's now joined us through video. So Jamie, do you want to introduce yourself real quick?
Sure. I'm Jamie Krause. I'm the new victim witness coordinator. And so I've been here since December 21st, and I came from the Eau Claire office where I worked for 4 years in victim services.
Great. And then is that Jackie Goodall, I take it, from DOC that's with us?
Yes, I'm here from department.
All right, thanks, Jackie.
Yep.
Okay, so I think before we go down through the rest of the agenda, as long as no one has any objection, we move forward to item 8, the Project Hope presentations. So Chief Atkinson can get us up to date on that. I think a lot of it hopefully will be pertinent to our work group and what we're trying to achieve in our work group. So thanks for being here, Chief.
Yeah, absolutely. Thank you for having me. So what I'll do today is just focus in a little bit on what Project Hope is and what phase we're in. So a quick overview of Project Hope. It's an evidence-based program being operated by the City of Menominee through the Menominee Police Department. It is comprised of 2 primary phases. One is phase 1, and that focuses on juvenile diversion and deflection opportunities to try to have juveniles identified for potential services, so that way they can avoid engaging in criminal type behavior or juvenile delinquency. And then phase 2 focuses on adults and identifying adults that primarily have substance use disorders or mental health issues that are impacting them and causing interactions with the criminal justice system. And that too works in effect with diversion and deflection. So as of last year, the Menominee Police Department was directed by the City of Menominee Common Council and Mayor Knack to enact Project Hope Phase 1. Phase 1 of Project Hope consists of primarily the utilization of youth services officers to partner with people from human services, local counseling services, and then the school district of the Menominee area and their counseling services to identify juveniles that have potential behavioral problems that are leading to basically delinquency and potential criminal activity for deflection opportunities. So if there are children that are either experiencing some behavioral outbursts in class, in the halls, or identified as having some issues that have shown to lead towards problems in the schools, those students and juveniles are identified by school staff or social workers, or if law enforcement, the youth services officers have them, and then they help develop plans to determine what kind of services may be available to them. So it could be as simple as recommending some kind of counseling to the child, as well as to the families. So we make sure that the families are aware of what is happening, because studies show that you need to have the parents or guardians involved in the process. So we've had several deflection interventions basically done with these children to try to help them be successful. Some of the other type of deflections that we utilize are mentoring. So if we find that maybe they just don't have a positive role model in their lives. We try to pair them then with someone who can help guide or coach them. It may be one of the officers, it could be one of the social workers, it could be a teacher within the school. It could be any number of persons identified in our group to try to help the students. So it's the whole deflection piece is a very hands-off, just trying to coach basically the juvenile on how to get services, how to help behave, help the parents. Some of these parents, they're very well-meaning and they want to help their kids, but they just don't know how, or they don't know what services are available to them. And thankfully, I think Dunn County has an exceptional array of services, from counseling to human services to just people in the community that are looking to help. So then another identified issue that has led to delinquency has been truancy. Now, COVID-19 has really kind of put the school district in a spin when it comes to dealing with truancy. And so we haven't done a whole lot with that, other than at the moment we have completed out our systems mapping for truancy and how these students get identified as truants, because there was quite a gap in the notifications of truants between the school and human services and law enforcement. So we've expedited that particular process to try to intervene and get the children in school as soon as possible. Again, as an evidence-based practice, studies show that having children in school, it improves their likelihood of not committing crime and being successful later in life. So that is that particular goal, is to make sure that the kids are in school and it's addressed. Because if we wait 60, 90 days before we can address a truancy issue, they've already missed several months of school, and it is exceptionally difficult to get caught back up, if not near impossible. So we've identified those shortcomings that we've had, and it was in every aspect. So having this collaborative partnership to address truancy has been exceptionally helpful. Now we move into the other part, which is the actual diversion type piece. And the diversion is where we would do a referral to human services for some kind of either like a status offense or what would be a statutory offense. So your disorderly conducts, your batteries, you name it. It could be even ordinances too, what we would identify as writing juvenile and ordinance violation. But here's what we're working on with that piece. And we're just getting into the phase of identifying the diversion and how to do that. We are going to be utilizing a community assessment tool that was designed in Florida. It's an evidence-based tool that law enforcement, social workers, counselors, teachers, if they're trained in motivational interviewing and in the tool, can apply. It helps identify criminogenic needs that the juveniles may have, as well as pairing with what kind of community resources there are available. So if, let's say, a student was engaging in disorderly conduct, it went beyond just behavior of acting out in a classroom or in a hallway, but actually constituted what we would normally either write someone for or arrest someone for as disorderly conduct. Instead of doing that referral or writing that citation, if we can get them into the diversion program, the child wants to do this, the parent wants to do this. An example of that diversion could be maybe there's family counseling that is needed. They're struggling at home. Mom and dad don't have those resources, and we're finding that they've run out of options on how to try to help their child. If the family counseling comes up as one of the treatment pieces for it, instead of writing that disorderly conduct citation or referring them, we would offer that opportunity. If you seek out this counseling and complete it, you will not receive a citation. You will not be referred to human services. We will track it and we will come back to it at later times to make sure that a person hasn't recidivated, so that way we can determine whether or not something has been effective or not in the community. And we feel that this is going to help alleviate some issues on a variety of fronts. One, it'll help limit some of the work burden that our human services is facing with juveniles. On average, we are referring about 200 juveniles a year to human services, and it takes a considerable amount of time to process. If we can even just minimize that by 25%, I think that would have a significant impact on human services. Plus, it would give the opportunity for these juveniles to have a second chance and maybe go to different opportunities with either mom or dad or their parent or guardian, whatever it may be. And if counseling's an option for them, and that helps give them the tools to successfully navigate life easier, because many of these kids have sustained a significant amount of trauma, maybe have experienced drug abuse, alcohol abuse in the home. They'll have some ways to be able to cope and deal with it versus acting out or engaging in criminal type behavior. And again, hopefully staying in school. And if they stay in school and are there, they're less likely to commit crime, more likely to graduate high school, and then potentially go on and join the workforce or continue their education. So really that is the real quick overview of phase one of Project Hope, is really just trying to identify kids ahead of time that either are engaging in behavior that has been shown to lead towards delinquency or criminal behavior. And then those students who have raised, or juveniles that have raised themselves into committing ordinance violations or criminal violations, about trying to get them into resources to get them out of the criminal justice system, much like what the pre-charge diversion program would have for adults. So we're identifying basically low risk, medium risk type juveniles to get them out of the system. The phase two portion, which we are not in right now, but for the adults, that will also have diversion and deflection opportunities. For deflection, it'll really be identifying those people that have either suffered from overdoses or who are prone to overdose, like extremely addicted, methamphetamine, heroin, opiates, those sorts of things. And then doing intervention strategies with those folks, removing barriers to treatment, counseling opportunities. And we do have ways to remove barriers too for the juveniles too, because a lot of their families have barriers like transportation, finances, those things too. And some of that has been financed by the city as well. So going back into the phase two portion of it, the other part too is having more increased effort on officer-led diversion or deflection pieces. So if we can refer people to the district attorney's pre-charge diversion program, that is great. For those that may be facing an ordinance violation versus say a criminal referral, we'll have a localized diversion piece for that too. So we can try to divert people away from that part of the criminal justice system and provide some opportunities as well. We've experimented with that on a couple folks that had some significant barriers that in all likelihood, if they were not have offered that diversion, would have ended up leading to further arrests, and definitely would have been in the hands of the district attorney, and probably would have been a visitor of chief deputy's jail over there. And luckily that particular person, or that one person that we first tried it on, was a success story. And that was done through both family counseling as well as substance use disorder treatment. The person had a significant substance use disorder, and then some counseling for some mental health issues. The person is no longer has a suicidal ideation, which was an issue, and it seems that they have mitigated some of their substance use problems. So just as the studies have shown throughout the United States, those places that have implemented police addiction and recovery initiatives or diversion type programs like what we've done for pre-charge, they've been successful. And we're just looking at broadening that throughout the city and offering that for others. So really that is what the Project Hope is in a nutshell. And we're very proud of it, and it's just getting off the ground. I'm hoping over the next 2, 3, and 5 years, we'll have a significant amount of data that we can end up sharing with the Criminal Justice Collaborating Council to show its effectiveness, as well as being able to understand what areas of improvement we need to reach. I kind of threw a lot of information at everybody there. Does anybody have any questions about Project Hope, timelines for phase 1, phase 2, any of those kind of things, costs, that sort of thing?
So Chief, I was
No,
wondering, when
Yep.
did phase 1 start?
Phase 1 officially started in the spring of last year. So right at when COVID-19 was taking effect. And so what that looked like by starting, that meant that the city council authorized funding for the police department to start implementing programming. And really what happened is with that funding, that enabled us to start having planning meetings with Human Services, the school district of the Menominee area. We were able to understand what each of our roles are, what were the goals, and this formed what was called the Youth Response Team, for those of you who might be familiar with it. So the Youth Response Team is the group that has basically done some system. Yeah, my lights already went out. I know what you're going through, Andrea. So to kind of steal a page out of the CJCC book, we started doing system mapping right away. Although that can be a tedious process, it really proved to be important because we were finding where we had gaps, our strengths, weaknesses, our opportunities and threats. It was really a kind of a SWOT analysis of what we did. And then we were able to determine where we could have different points in the system to try to either divert, deflect, or make sure that we don't lose a person in those cracks. And then so as we moved into the new school year here this past fall, we started with the deflection piece of it. So we started identifying those students that either we know have sustained significant amount of trauma over the years, just because our school counselors or social workers maybe have had interaction with them or help provide services. And then we were able to reach out to those students. And really it becomes about wraparound services too. So that way they know that it's a community of caring, a community of rehabilitation, a community sense that you belong and we want you to be successful. And then so as that part evolved, then we transitioned into the truancy piece of how we could address that once school returned to normal, quote unquote normal, about bringing kids back and expecting them to be in class. Right now, that's a challenge just because some students are in the virtual environment, some are in class, and then some chose the homeschool model. And then when COVID spiked again in the fall, they were offered opportunities to go back to just do virtual versus coming back. So that really presented some significant challenges on truancy. And then as we finished up the mapping on that, we are now, we have officers that are trained in motivational interviewing. They are going to be receiving training in the community assessment tool that was designed in Florida. Florida is a very unique state, not just for its lovely weather, but their state actually mandated this kind of activity, evidence-based protocols and assessments in their police departments and in their criminal justice system. They're one of the leaders in the United States. So they got a lot of data and a lot of things to utilize. So why reinvent the wheel? We ended up stealing a fair amount of their stuff as to what they do. So they'll also be providing us some training on how to utilize that community assessment tool, just so that way we fully understand what it is we're doing, which I think is a wonderful thing. We want to make sure that we're giving people the right dose, so to speak, of criminal justice participation or interaction with law enforcement or human services. So we're in that piece of it right now. And once that is completed, when we start doing our diversion pieces of it, those students or juveniles will then be given this community assessment tool. So that way we know what are the best strategies to try to get the juveniles and their parents to, if it's a parent issue as well. The upside as to how all this kind of relates to the drug endangered children is because we, as industry experts, we know that a lot of delinquency stems from issues at home, trauma, exposure to drugs, alcohol abuse. And this will allow us also to be able to, one, build trust with juveniles so we can identify if kids are in danger and either need to be removed, or if parents are suffering from substance use disorders. They certainly can be referred for charges. And then with the family treatment court alternative that we have now is very fitting with this, plus the drug treatment court options that we've had for what, about the better 10, 15 years? Probably longer. Chief over there might know the exact date. But anyhow, we have a lot of great opportunities for those folks. So you asked a simple question, Andrea, and I kind of droned on. So I'm sorry.
That's all right. My other question I had, because Sheila Story, who's part of this group, has expressed some interest about, you know, a mentor program. And so I'm curious, you know, who is in charge of that mentor program, how many mentors you have, how many kids you have involved in the program, how often they meet, any information on that you could share?
Investigator Zassenhaus is the one that has been spearheading the mentorship along with Investigator Harmon. And so we've had partnerships with the Boys and Girls Club. And right now it is really a simple type mentorship. What we are exploring is some official training type mentorship that once this COVID stuff can kind of subside, where we can provide training for mentoring and do that in partnership with our volunteers and policing program that we utilize. So that way we know what kind of training our mentors have, we can vet them. But right now what we'll do is we'll refer them to Boys and Girls Club, Big Brothers, Big Sisters, because they have ways of doing the background checks too for those. We want to make sure that if we're referring someone for a potential mentor, that they're going to the right person and not, well, a random off the street. Is Ms. Story interested in becoming a mentor?
Well, since she's not here, we're going to sign her up to lead the mentor program. I'm joking. I know she's going to be watching this session later. So,
that's right.
But
that's
yeah,
what happens when you don't show up.
That's right. That's right. So Chief, it sounds like you've got some of these meetings, the youth response team up and running in the schools. Have you been able to, is it primarily like the high school level? Or are you into the middle school, or how's that looking?
We have all levels from elementary, middle, and high school right now. We just decided that we were going to try to cast a wide net. So we've invited, we have counselors from each of the schools that come in and have a conversation with our youth services officers, as well as a representative from human services. So we can kind of talk about what we are seeing, what kind of strategies might be best for them, because of course, we have contact with some juveniles that human services may not be aware of. Human services may have contact with juveniles that we're not aware of. Certainly counselors and social workers in the school, same thing. So what we do is if we have a person that we identify, and we ask people to bring names to the table if they have concerns. And then we bring them up, have a conversation, we provide information, and we can share it amongst each other based upon the jobs that we do. And then if we find that, okay, yes, we know this is happening, or this maybe happened the other day, you should be aware of it. This is a student maybe we need to handle with care, maybe has some recent trauma. Now they're starting to act out in class, or all of a sudden they're not showing up. What is happening? Maybe mom and dad or a parent or guardian or a guardian had called in and saying, I need some help or assistance, and then we can try to work together to find the best solution. That's for the deflection type piece. So if we're seeing initial trouble spots that are going in, and sometimes too, these may be kids that have been introduced to, let's say, the juvenile justice system, but we're trying to find ways to keep them out of it from continuing further. So maybe they did have contact with something or referred at one time, But through either the course of work that Human Services does, or the schools, or the police, maybe the real issue is that they're not a criminal. It's the fact is that they have a lot of trauma. They might have a lot of abuse. Maybe they got some substance use. Maybe we're thinking, hey, they might have some kind of a mental health crisis that they're going through. We can get them to counseling or bring in services, because school districts do bring in psychologists, and then also we have ways to remove barriers to get them to see psychologists as well.
And Chief, right now, this is just for the Menominee School District, right?
Just for the Menominee School District right now. And we're hoping that we can expand it too. Now we do have a representative from the sheriff's office. Becca Merrifield does come to those meetings, so she will bring up juveniles that are in the townships, or maybe some of the smaller villages. And then that way, let's say if there is something in one of those areas, we can get services to them. Now, the Menominee Police Department may not go do a deflection with that person, but maybe someone from Human Services, or maybe someone from that school district will assist. But right now it is primarily MPD. Oh, one more thing I do want to bring up too. So we have adopted a school education program, and some of you have heard me talk about it before with the Botvin Life Skills. With the pandemic that's taken place, we did not put that into action here this school year. For the 2020-2021 school year, the school district asked us to hold off on that, just because they weren't sure about the programming for the kids, to make sure, one, are they going to have in-person schooling? What will that look like in the virtual, et cetera? And so we're holding off on that until next year for schools inside of the city. What we are looking at doing is, before the spring semester ends, is we are going to be delivering an online, basically a webinar for parents of the Botvin program. And it's geared towards middle school students. So prevention methods, how to talk to kids, a way to identify potential issues, those sorts of things. And that is part of the Botvin program. And most of our folks are now trained in the elementary, middle, and high school level for delivery of Botvin. And then our YSOs or investigators are reaching out to Becca about seeing if she wants to do some of the training too. And then we'd like to invite the sheriff's office to participate in the spring program for delivery to the middle school. We understand that the middle school is in the city, but we figured, hey, why not? We need the SO in there, because a lot of those kids come from the townships. So we think that your folks, Chief, would certainly be interacting with a fair amount of those students that are living out in the townships. Anything else? Well, I see my 5 minutes. I took up about a half hour. If you need to get somewhere in a hurry, I'm probably not that guy for you. I'm sorry.
That's all right. More information is better than less. So,
okay.
Thank you, Chief, for your time. And sounds like, it was very valuable given some of the discussions we've had. It sounds like there's some overlapping kind of goals going on. So I think that's something we'll have to work on to make sure that, we're utilizing some of the work that you've done to assist us with our goals moving forward. So appreciate your time.
Absolutely. Yeah. Thank you for having me. Have a great afternoon.
All right. Thanks.
Thanks.
Bye.
While we're on the topic, I just had a few questions for Carrie. So Carrie, how is this, is your agency involved in these youth response team meetings?
Tracy Erickson, our juvenile court intake worker, is the one that's attending them. They hold them every other week. So she's the one that goes, and she's kind of been the liaison basically for all of our workers. So, for example, they brought up one student's name that we used to work with. Our one worker, Danielle, had a really good working relationship with that family because she had served them for a couple of years prior. So Danielle just reached out to that family and said, hey, I heard that, your little guy might be struggling. Is there something that I can help you out with? And got them reconnected to services in the community. And he's been going to school ever since. So it was just, some of that stuff is just doing some of that liaison work. At this point in time, I mean, it's probably takes up a couple hours of Tracy's time every other week, but hopefully the benefits of all of that will definitely pay off. So.
And so if there is a juvenile who's involved in the deflection diversion program, is your agency then opening a case on that?
I don't really know how that's going to work yet. I believe, Chad, and maybe you know more than I do, I believe that the officers are supposed to be doing this assessment tool basically out in the field. And then if they screen as low risk, that there's not a juvenile referral. Right, Chad? Is that your understanding?
Yeah, that's my understanding.
And that they would basically be having to do some programming instead through that Florida model. And then, which involves, there's like some type of education piece and I don't know, like a whole bunch of different topics. I don't know a whole lot about it, but my understanding is that the hope is that they do this programming piece, and then if they do that, there will be no juvenile referral for, the disorderly conduct or whatever it may be. And then if they don't do the programming, then there is a juvenile referral.
Yeah, and I don't know all the details on what programs will be required to complete, but they are, depending on what the violation is, they'll have to complete some type of online program. And then, yes, if they don't complete it in a timely manner, then it gets referred or citation issued. So.
And Chad, is it primarily Harmon and Zassenhaus that are involved? Because those are the two school liaison officers?
Yes, primarily it'll be those two.
Okay. And so since we have Jackie with us, I'm wondering, so if we have a juvenile whose parents in the system on probation, is probation aware, that this is going on and that there's something probation could do to help the parents ensure that they're doing these things for their kids?
Yeah, I think what we would probably do would, once we'd be able to refer them, give them the tools that they're going to need or where they're going to need to go. So a lot of the kiddos to our people on probation are probably, some of them, we see the children obviously also then on probation. So I think this is going to be good to refer them early and maybe even be able to get them like mentoring. I think we could be the people who refer, at least. We could get something in our office, like once we go back to normal, like showing the different resources that's going to come along with the program.
Yeah, Jackie, I like the idea of you guys making some of those referrals, because I'm sure you're seeing these kiddos and you're knowing that they're already at risk just due to their environment, Right.
We see lots and lots of like generations. So I think this is going to be great. And yeah, I think we should maybe come up with some kind of a form where we can do these referrals, and that could be like the first step for then Chad or whoever does the assessments to see where their risk is gonna lay, if they're gonna be low or how they're gonna proceed with the different resources.
Any other questions or discussion on the Project Hope? Okay. All right. So should we go to all the way back up to item number 3, approval of the minutes from our November 25th meeting? Sarah sent out, I think our meeting in December was that mapping. So we're way back to November. Anyone have any?
I'll make a motion to approve the minutes, Andrea.
Okay. Anyone second?
I'll second them.
Any discussion or changes anyone wants made? Okay, all those in favor of approving the minutes from November 25th, signal by saying aye.
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 Any opposed? Okay, no opposed. So those minutes are approved. Sarah, any staff report?
Yeah, real quickly, just wanted to update the group that we held our first CJCC meeting of the year just last week. So Andrea was reconfirmed as the chair of this work group. So I just appreciate her leadership in this group. We also reviewed goals. We had some pretty defined goals for this work group last year when we were working with Charisse. Some of those are carrying over, and then I think there's room for more discussion down the line. So maybe that's something Andrea and I can discuss and kind of bring back to the group. Because, you know, we were really just kind of looking at our list last year of what do we still have to do. There was just a couple things left, and then I think we have opportunity with our new leadership to set some new goals for this group. So. And then there's some additional resources on deck that I'll be sharing, some different training opportunities like introduction to DEC. So some of these national training centers are putting together virtual training. So I'll send that to the group. And then also just a call for any additional resources that you'd like added to our website. I'll put these training links on there, but I'll also send them to you guys directly so you can check them out if you'd like. But we just want to keep that the website relevant with information. So if you have things to add, let me know, and we'll have Krista or Rita put those online for us. But that is it for staff report, unless there's questions.
And not to pick on people who've joined, but Alyssa, I think you've joined us. Are you from Public Health?
No, I'm from the Bridge to Hope. Sorry, I'm at work, so I've been shutting off my camera.
Great. Well, thank you for joining us.
Yeah, thanks for having me.
Yeah. And how do you pronounce your last name?
Fahrenkamp. It's German, so it's really Fahrenkamp, but yeah.
Okay. Well, thanks for joining us. All right. So our next item is update on DEC staffings. I don't know if there's any update at all.
Yeah. Is that me? Did we do a stat? I don't know if we did. I know we did one a couple months ago, but I don't think that we've done one. We didn't do one last month. Did we, Chad? No. So it's been 2 months, and I already reported out on that other one that we did. So no new staffing report there.
And as far as an update on outreach to schools, I think Sheila was sort of spearheading that, and I think still was waiting to hear back. So I don't think we have much of an update on that. So I'm going to move down to update on our DEC mapping and next steps. I just wanted to say thank you everyone for our time. There was a lot of human services who was there. That was very impressive. And there was a lot of everyone there. So I think we had both of our drug investigators and human services. Pretty much seems like your whole agency was involved. And so I'm very appreciative of everyone's time for doing that. I certainly found it helpful, and fortunately I had to go to court, so I missed some of it. But Sarah, I don't know if you have any update on, I think you and Sheila were working on putting that together. So
Yes, so thank you. So yeah, we held that mapping on December 2nd. So it was 3 hours that we set aside. It was done before the 3-hour time frame, which was good. And we had 21 participants, as what I recorded. I know there was folks coming in and out, and others said that they were there that I didn't necessarily record, but we had at a minimum 21 participants. And it was we had, I think, a good variety of kind of cross section to hear from folks. I'm still putting together the map. So our intention was to do live mapping, but because of technology constraints, we just weren't able to do that live mapping. So we could all see that visual as we were moving ahead. So we're really processing a narrative document, a map, and then we have a list of identified gaps. And I just wanted to hit on some of those list of identified gaps, so we can so you guys can be reminded or refreshed of some of the areas that we might want to spend some of our time. But the plan is for me to finish the draft, send it to Sheila to add her additional details, because she took some detailed notes as well. And then we want to bring it back to the group to make sure it rings true, right? Make sure that we really did capture the flow, the map process, and then that narrative, that it actually makes sense. So we'll be bringing that back. But some of the identified areas of gaps or weaknesses. So, and these might not be gaps like we don't have it, it's just areas that could be improved. One would be the co-response of law enforcement and DHS. So that's something that's outlined in the protocols, but it sounds like not very often is that happening, or maybe not as often as it perhaps could happen. The second area I think that it was identified were the reports that are made to access really do have to have some common components and really convey the impact of drugs or alcohol on the parenting of the child. So there could be some training that we could provide on really how to submit a good quality access report for workers to really have all that relevant information to take it to the next step. That's that screened out, screened in process. It's really important early on to have that information. Referrals for child support, that was identified as a gap. There are some that were, if it's a short-term placement and then it converts to a long-term placement, the automatic referral system between human services and child support with the state system doesn't happen. So it's more of a paper process or an arduous process. And potentially some of those cases can get lost. It sounds like there's not a whole lot of cases that fall into that category, but there are some that could potentially slip through the cracks between those agencies. The medical provider piece with DEC, it sounds like that, that was recorded as missing, that piece was missing or it's inconsistently applied. That's where we have like the pediatrician, so, and this piece, I don't know if it's the kids aren't going to the doctor or they're going to the doctor. It's just an inconsistent, perhaps, medical perspective of what's going on, depending on the drugs and the impacts of those drugs. So I think there's some work to be done on that medical provider piece. And then the fifth, major gap that stood out was lack of services for kids. So we talked about some of those auxiliary or just those services that might be available for foster kids, like the foster closet, but it sounds like there's really not a whole lot of services for kids. So that's kind of the short notes of what we're looking at for gaps. But as I mentioned, this will be a document and a map. So once I finish it and get it to Sheila, we'll bring it back to the group. So we hope to be able to do that by our next meeting. Any questions on the mapping as far as the update or next steps?
I missed that whole mapping session because I just happened to break my foot that day or the night before. But if you need any help, Sarah, just going through kind of the processes of everything, if when you're doing the mapping session, if you have any questions about anything, feel free to reach out to me and we can talk it through.
Great,
If
great.
something's not quite making sense, I'm happy
Okay.
to take a look at it before we bring it back to the group.
I appreciate that. Thank you. So I'll take you up on that.
Well, yeah, thanks, Sarah, for that overview of the gaps. I think that certainly, again, was a worthwhile exercise, and I think it will help guide us for our goals for next year, or this next year moving forward. I would suggest that, we try to use those gaps to determine our goals for next year, and that we discuss that at our next meeting. I don't know if it's able.
Yeah, I think that's great
before
idea.
or not, but and then my concern is just making sure that whatever efforts we decide to do, we're not reinventing the wheel, since MPD has started this new project as well. So I would suggest we end the meeting now. We've gone through these things, and then we focus on our goals moving forward. Does anyone else have anything else they wanted to add? No. Okay. So I think we'll send out a doodle poll for the next meeting, and then we can figure out our next steps from there. Any objection to ending a few minutes early?
Of course
No.
not.
Okay. All right. Well, thank you all for coming, and I'll say the meeting is adjourned.
That's good. Thanks, everybody.